Okay.
We'll pause for just a minute, let attendees join.
Yep. What have we got? There we go. They're starting to show up now.
Good morning. It's an honor to be asked to participate in this year's Purple and Gold Day of Caring. Welcome to the session entitled Mapping the Pandemic, Creating the Illinois COVID-19 Awareness Dashboard. Thank you to Brad Boehner and Amy Spellman for putting this together for this very important event for our students. I'm Chad Sperry, the director of the GIS Center at Western Illinois University. I'm involved in many facets of emergency management. I've been at WIU for 16 years now. I'm currently the president of ILGISA, which is our state GIS association, and I'm a WIU grad from 1995, and I'm also originally from Macomb. Chris?
Hi, I'm Chris Sutton. I'm a professor in what is now called the Department of Earth, Atmospheric, and Geographic Information Sciences. Previously, the Geography Department and Geology Department when we were separate. Like Chad, I'm a WIU alum. I did my undergrad here and finished in 88, and then got my master's degree in 91, and then returned as a faculty member in 1998, and I've been here ever since. I teach GIS and cartography classes and geovisualization, and so you're going to see a lot of that as we go through the dashboard. But we're going to begin by having Chad give some introductory remarks, and then I'll walk you through the dashboard, because if you've been to it, you may not realize how much detail there is. So Chad, I'll throw it back to you.
All right, thanks, Chris. So this dashboard initiative began to form when we were contacted by Chris Helly about making a map for Fulton County, our neighbor to the east. We then had Renee Bucher started assembling data from various state sources. And it was at that time that ILGISA suggested that a dashboard be made, a GIS dashboard for the state of Illinois. That was many days ago, back in March 19th, when we could still buy toilet paper. This dashboard was pretty much an instant success, quickly became the quote unquote official public facing dashboard. There were dashboards back behind Homeland Security firewalls, but this was the official public. And at that time, many of our contacts at state agencies began sharing it. We then had a university relations press release that went out and was broadly picked up. The dashboard had over 20,000 views in the first weekend that it was live. Frequent shares to social media by Chris has helped keep this in the public eye and helped keep a fascination with it. We are now over 600,000 views on the dashboard. So the dashboard can be accessed by visiting the following website. If you type in gis.wiu.edu into your browser and hit the enter key, the top link there is the COVID-19 dashboard link that we're going to be talking about today. So the power of the dashboard is in its use, and with that, my co-presenter, Dr. Sutton, will explain the various functions, including many hidden abilities of the maps, charts, and statistics, and he'll explain why one map really doesn't capture the full essence of the pandemic that we're under. Chris?
Thanks, Chad. I also want to point out in addition to the gis.wiu.edu site, I will share my screen now. If you go to the WIU webpage, at the top of wiu.edu is a host of links for things, and I think we have the links here, but there's also a COVID page on wiu.edu. It's also wiu.edu/IL COVID map, which I will try to populate here. See if that works. Nope, I did it wrong. Well, anyway, but you can click through the WIU browser to be able to see the same thing, and among the WIU COVID resources. We also have a mobile version, which has far fewer elements of the dashboard that I'm going to walk you through. And I have the dashboard up on the screen right now. And in the upper right-hand corner, you'll see a link that will be to the mobile site. So it's a little friendlier if you're looking at it on your mobile phones or tablets. And if you're at that site, you can also, in the same location, click that link in the same corner and return back to the full site. So as Chad said, we've been working on this dashboard since mid-March, and the dashboard grew out of sort of a convergence of efforts. Chad indicated that in the GIS Center, there was work that was done by Renee Bucher to start putting together the COVID-19 data in map form. And I independently started doing the same thing as Johns Hopkins University, whom you may be familiar with their global site, had started to release county level data. And so after I had finished my first map, I went over and met with Chad, and we decided to combine efforts on the dashboard and move forward. So I'm going to walk you through the elements. If you've not been to the dashboard, this will be your introduction to it. There are a lot of people who have used this and have communicated with Chad and me over the last month and a half or so. And many people don't realize just how robust the site is and how many elements are in the dashboard itself. So I have the opening screen up on the Zoom site here, which is what would launch when you are first logging into the site. And again, this is not password protected, so anybody can access this. And what we see here in the middle is a panel that has a map of Illinois where we have graduated circles indicating the number of confirmed cases, and then the rest of the country is also highlighted with the orangish circles, but we went with the WIU purple to create our circles here, and you see a lot of WIU purple and gold woven throughout this site, and a lot of alumni have made note of that as they've communicated with us. So first thing I want to point out is that all of the maps that you see in this site are interactive. So this is not a static image here you're looking at. It's one where you can zoom in and certain things turn on and off as you do so. And you can see, for example, the labels where it gives you the county name and number of cases. You can also pan outside of Illinois if you choose to, and be able to see data at the county level for other states. And then if you click on any one of these symbols, you'll get a pop-up that will show you how many confirmed cases and deaths each county has. And one of the things that we realized shortly after the dashboard went live is that while this is a dashboard that is intended to focus on Illinois and highlights a lot of the COVID-related elements in Illinois, that there are elements that are national, and we have had communication from alumni in various parts of the country that say that they use this same dashboard to look at, say, the Bay Area and San Francisco, and click on San Francisco County and so forth. So if you launch this site, you're able to move around. Whoa, I just lost my screen here. I'm not sure what happened. There we go.
I'm still
coming back.
Okay.
Yeah, there we go. Can you see it now, Chad?
Yep.
Okay. I don't know what in the world just happened, but my computer went black on me. Okay, so so we have this map, and again, you have to be careful about this. If you scale too far out, then everything becomes a little cluttered. But the other thing, and this will be true for all of the elements that I'm going to walk through here, is that in the upper right corner of each one of these elements, there is a button or an icon that allows you to maximize the panel that you're looking at to fill up your entire screen. And so that way, if you have a smaller device, a smaller screen, you're able to maximize the panel that you're looking at. And so there we go. Now we'll minimize this. So let me walk you through some of the other side panel elements and indicators, and then we'll come back to some of the other maps that are available here in the middle of the dashboard. So if we look over at the left, we have a running total of confirmed cases and deaths for the state of Illinois. And what I do every day is when the press briefing occurs from the governor and the director of the Illinois Department of Public Health, I enter those into our dashboard and that updates. So you get how many new cases occurred each day. So this was from yesterday's press briefing where we had 1,826 new cases, how that compared to the previous day and what the total is, and in both cases and deaths. But in both of those panels, there are tabs at the bottom where you can click and switch those to other elements. So we have confirmed cases and deaths for the United States, and then the global figures. And those come from Johns Hopkins University there. So as you will, if you play around with the browser, you'll see that there are all sorts of tabs in each one of these panels that allow you to switch information. The only element at the moment that does not have tabs is the one in the lower left-hand corner of the screen, which is the remaining counties in the state of Illinois that don't have confirmed cases. Those are also shown on the map in the green. And so of the 102 counties in the state of Illinois, we're down to 6 counties that have not had a confirmed case yet. To the right of the map, we have all sorts of things going on. The panel immediately to the right of the map is showing us COVID cases and deaths by county for the entire state if there's been at least one confirmed case. So you can scroll through this and you can see, for example, where Cook County is and Lake County, DuPage, and so forth. There's also a unassigned county element that shows up in the list, and this is when testing has resulted in a confirmed case, but they have not assigned that case to a particular county yet. And so one of the things that we saw here in McDonough County when the first case was recorded was that we had an individual that had been tested in Fulton County. And so that was a positive there, but the person resided in McDonough County. So sometimes there's a little bit of a lag of getting those cases assigned to specific counties because of instances like that. There's another tab below here, which I will get to in a sec because it relates to another map that's in the dashboard. And then we decided to populate the dashboard with all sorts of more general information in the bottom right, where you can see information about the entire country, as well as a different kind of scales of analysis. So we have a list here that shows the top counties by cases, and they're sorted by cases. So you can see, and New York City is aggregated as a single entity as opposed to the 6 counties that actually exist within New York City, but everything else is a county. You can see that Cook County right now is number 6 in the nation with number of cases, and you can scroll down. Now, this is not the complete list of counties in the United States because there's over 3,000. So we kept it to the top 30. We have the states, and this is just the top 10 in terms of number of cases. And you can see Illinois also is number 6 in the nation with the number of cases. And then we also have a tab over here showing us by country. And so these data over here come from the Johns Hopkins data set. And then above that, we have a handful of graphs, and depending on the size of your monitor, you may or may not see tabs. And this is also true with other elements and other panels, that instead of seeing individual tabs, what you see is the name of the the element, and then arrows on either side, and the arrows are what allow you to toggle. So the opening graph that we have is one that is confirmed cases, and what is present here is it's a combination of both daily cases, and if you're on a computer, if you do a mouse over or if you press on it on a tablet, for example, you'll get the data that you can pull out from here, as well as up here, which is a line graph showing the total number of cases by day. And we just go back to the last 3 weeks. Obviously, the data go back a lot farther, but the graph becomes unreadable at that point if we were to integrate all of those days. This in particular is noteworthy, and I put a title up here that this is a logarithmic chart. So the axis is increasing tenfold for each indicator as you go up. And we'll see a different graph that is not a log graph. But what this does is gives us a better way of representing sort of the progression of cases in the state of Illinois. We have the same exact style of graph for deaths. And so the same thing occurs here. You can see, for example, on April 19th, we had a low of 33 deaths, not the lowest, but a low point here. And then we had 119, 123 yesterday and so forth. And then we're seeing the progression of deaths over here. The next chart is what a lot of people are used to looking at when they're seeing the change in number of cases over time. And that is not a logarithmic chart, and I'll maximize this. One of the things that is also built into this chart in particular is, hopefully this maximizing doesn't crash my computer again. Okay, is that we have a slider up here at the top where you can actually adjust the range of the data. And by sliding the left slider to the right, you're changing when the starting point is of the data. And if you're doing it from the right, you can scroll backwards. And so you can do a custom range of data in this particular graph. And then, well, maybe the next one will, I'm getting some computer lag time here. So there we go. So this is the same chart, but it's a log chart. So we're seeing, and this is when you're talking about flattening the curve, you see the log graph is doing a little better job of representing that. And then the final graph right here is the number of tests over the last 2 weeks. So we have daily tests down here at the bottom, and then the cumulative number of tests over time. And so I had an email or a Facebook exchange this morning with one of the people who's watching today about combining the tests with the cases data to show the relationship of growth of cases as they respond to increased testing in the state of Illinois. And that brings up an important point, is that the dashboard itself is dynamic in nature, meaning you can interact with it, you can zoom to things, you can enlarge things, but it's also been a dynamic dashboard over time where we have added or deleted elements as more data have become available or things have become less meaningful. And so we are constantly making tweaks to this, not major design changes, but we are making tweaks. So let me go back to the main map area here and where we have cases. And this is one of those, Chad and I were having a discussion yesterday about this. While it's a map that does a good job of visualizing the number of cases, and you can see very clearly where there are large numbers. And so Marion County, where Indianapolis is, you can and do data probing in this. It's becoming increasingly less meaningful as time is going by, because what's happening is the circles are basically representing population. So larger cities are having more cases, smaller counties in terms of population are having fewer cases. So one of the things that has been part of the dashboard for a while and may play a more prominent role as we move forward is the next map over, which is a map of the rate of infection at the county level. And this uses a different map technique. It's the choropleth technique, where we use shading to represent the data values. And so if you're not familiar with this technique, although it's fairly intuitive, the lighter shades, in this case on the sort of the peaches up to the reds, the lighter indicate fewer or lower rates, and the darker reds indicate higher rates. And it shows you a slightly different perspective on what COVID is actually doing, because it's representing the impact within the population. And this is a number of cases for every 100,000 residents, but you could convert that to a percentage. And then you get things standing out that may not stand out in the number of cases. For example, we have Jasper County in southeastern Illinois. And again, I indicated there was a second list to the right of the maps here. That second tab on there is rate. And so we have the number of cases per 100,000 residents listed here. And one of the things that we can see about Jasper County in Illinois is that it is now number 2 in the state in terms of infection rate. And that has a lot to do with there was an outbreak at a nursing home in the county. And this is also a national map, so you can pan and zoom around this, and I will do a little bit of that, because one of the things that, if I just go to about right here, that is starting to show up is it's pretty interesting that the high, and by the way, sorry for my jumping around with my content here, over in the bottom right, the list we also have the county rate list, and so that is also sorted from the highest rate to the lowest. And if you see this, for a long time, New York City was having the highest infection rate, but their number of cases has been flattening. And so what you're seeing is growth in other parts of the country, which are the areas that have the smaller populations. And you can see that if you look at the top 4 counties in the country in terms of rate: Lincoln County, Arkansas; Marion County, Ohio; Rockland, New York, which is actually outside of New York City; and Pickaway in Ohio. If you're not familiar with those, it seems kind of an odd thing for these counties to have such high rates. So one of the other elements that we've built in terms of interactivity into this dashboard is, if you are in the rate list and you want to know where Lincoln County, Arkansas is, if you click on the county in the list, it will pan the map to that, and it will start flashing the county. And you can see Lincoln County, Arkansas has almost 5,000 cases for every 100,000 residents. So it's about a 5% infection rate in Lincoln County. And this is, if we go back to this view right here, what we're seeing in the Midwest is a recent trend that, if you've been watching the news, won't surprise you, is that we're seeing spikes in counties that have 2 things in common in terms of really big increases. They either have prisons or they have food processing plants. And Lincoln County in Arkansas and Marion County in Ohio both have prisons. Louisa County in Iowa, which is the number 8 county in the nation in terms of rate, has Tyson chicken processing, poultry processing plants. And then, of course, there was some attention recently in the news in Sioux Falls of a surge in cases at a food processing plant there. And there's something like 700 cases from the one plant. And if we come back to Illinois, We're starting to see that show up in other places like Warren County, just north of McDonough County, Macomb, where there is a poultry processing plant, and we're starting to see a surge in cases there. They went from 16 2 days ago to 31 yesterday. And so if you play around with this map, you'll start to see patterns that don't show up in the circles. Here's another one to look at here, and people that study economics won't be terribly surprised by this, but we have an area in southwestern Georgia, and if you go across Alabama and Mississippi into Louisiana, you're seeing much higher rates than in other parts of the country, and these are predominantly rural areas. And those may relate pretty strongly to access to healthcare and income and things like that. So anyway, these two maps plus the third one that we have here, which is also going to be one that Chad and I discussed last night about converting to a rate map, is deaths. And again, this is a national map here. So we use the graduated circles to show, instead of just cases, we're isolating where the fatalities have occurred. And again, this is starting to end up showing that larger cities have more and less populated counties have fewer. So the rate map is going to be coming probably in the next week, and that will be able to inform people just like the cases rates map does. Now, we have several other tabs here in the progression that don't display data straight up. We have a couple, there's one map right here that I'll get to in a sec, but there's also a number of other things out there. The company that makes the GIS software, which is Esri, Environmental Systems Research Institute out of California, has a business analyst element, which is dedicated to using GIS to understand the business world, modeling, and so forth. And they put together a whole series of infographics at the state and county level for COVID related elements. And so we inserted the Illinois infographic here. And so one of the things that's kind of interesting about this, and we'll see this in the others, that this is actually a 2-page coronavirus element, and that there are all sorts of elements here that if you click on them, they show other information, or they show information of the infographic in more detail. So we have that just as an overall information piece for the state of Illinois. And then what we have is this image that doesn't look all that great, which is just Illinois at the county level with all these dots. And what happens is if you click on one of the counties, you'll get a pop-up, and a couple things will happen. And so I've clicked on McDonough County here, for example, and if you click on that, you'll end up seeing, if it loads here, the county infographic. And again, just like the state one, it's a 2-page element, but it is for the county specifically. So if you're living in a different part of the state, you can look at Peoria County, Tazewell County, Will County, or whatever, and see, age breakdown in terms of the senior population, businesses, daytime population is an important element because more populated counties have people coming in for jobs. But there's also a second element, and this does not exist for all counties yet, and that is that if a county health department has an information page out there, we have a link to it. And so if you click on McDonough County, for example, you'll get the McDonough County Health Department dashboard that Chad put together that shows county-specific information. And what you'll see is that if you look at these elements for various counties in the state, there's a wide range of quality to these. Some are really informative and break down a lot of information. Some just have the generic CDC, COVID, what do you do and how do you do social distancing? And so there are a lot of counties that do these specifically for health department releases of information. This is a little buried in the dashboard for now. It's an active case map, which shows data from the Johns Hopkins University data stream, and there's some limitations to it at the moment. And the limitations are that Johns Hopkins right now is releasing only confirmed cases and deaths. So really what this map is showing is you take the confirmed cases and you subtract the deaths. What is not being released recoveries. And as that information starts becoming more prevalent, then this map will change quite a bit. We also have a tab for generic COVID resources that's put together by the Illinois Geospatial Data Clearinghouse, which is run by the Illinois State Geological Survey at the University of Illinois. And they've put you just scroll through this, a lot of different information that is COVID related, that some of it is specifically for the state of Illinois. Some of it is more generic about the disease itself, and other institutions and agencies that are out there putting COVID related information out. And there are links to all of those sites as you browse through this. And then the final element of a map right here is the feed from Johns Hopkins University. And this map is a variation probably on one that you have seen. If you have seen the Johns Hopkins map, they actually have a handful of different iterations. But the point of including something like this is for people who are using the dashboard to be able to see the state of Illinois, but also see it in the context of the country, and then also see the country in the context of the world. This is an interactive map, and so now you can zoom into Europe, for example, and again, all of these circles are probable, so you can click on them. And at this level, at least, Johns Hopkins is putting recovered data in for countries, and European countries have been releasing that information more cohesively than what we were seeing in the United States. So I clicked on Belgium, so you can see the number of cases, deaths, and then they're reporting 10,000 plus recovery so far. So in a nutshell, that is what we've put together. Again, and I'll flip back to maybe this map right here to sort of summarize what we've done with the dashboard is we've integrated data that has come in from various sources. Right now, our two major sources for the map data are from Johns Hopkins University and from the Illinois Department of Public Health, which is funneled through the Illinois Geospatial Data Clearinghouse, and they create a GIS or map ready layer for the data that are there. And then we spend the time here integrating it. And like I said, when I introduced myself, I spend a lot of time teaching about geovisualization, which is about when you have data in a map form, how do you effectively communicate that to people? One of the things that you may have seen if you've looked at a lot of the other maps that are out there is that there is a wide range of quality of the maps that are out there. And some of them are very difficult to interpret, or you have a situation where you have a map on one web page and then you have to open a different web page to get to a different set of information and open a third web page to get another piece of information. And having a dashboard set up like this where we could integrate tabs and lists and indicators and charts all in one interface, which you can then maximize or switch between to be able to see the various elements, is a pretty effective way of doing this. But the point is that we're trying to highlight the state of Illinois and get the Illinois data out there first, but then to enable people to look beyond Illinois if they would like to. So I think that's going to wrap up the walkthrough of the dashboard. So I'll stop sharing my screen here and I'll flip it back to Chad, who will talk about some of the other connections that the dashboard has had institutionally and beyond. So Chad. Are you there, Chad?
Yeah, there we go. I'll unmute myself. Can you hear me okay now?
Yeah.
Thanks. So if you look, thanks Chris for that great overview on the dashboard. If you look at our backgrounds that Chris and I chose to use, my background is where the dashboard started. So this was the initial dashboard that I built. And once Chris got involved, we expanded it to all sorts of data elements. You can also see the counts and how it's progressed over time. And this has taken a lot of work. It's been a mutual effort of working with the state clearinghouse, working with Johns Hopkins University to keep those feeds up, to manipulate the data on a daily basis. Chris has done a great job with that. And it just kind of continues to solidify the reputation that the GIS Center has in the state of Illinois for working in all sorts of fields related to emergency management. So we kind of, started developing this solid reputation in the field of emergency management in our ability to apply these geovisualization, these GIS, geographic information systems technologies. This is due in a large part to our initial involvement with the Taylorville tornado. So back in 2018, we were called in to assist with the Taylorville tornado response. We did a lot of drone imagery. We put together dashboards, and that helped the general public just understand the magnitude and the impact of where cases where homes had been damaged in the Taylorville tornado. We've also been involved in multiple search and rescue efforts over the years using drone technology and GIS technology to find both missing persons and fugitives on the run as well. We also worked with the state on the warming center map, and we had got some good recognition from the governor and our work with the warming center map back in 2019 when the feels like temperatures dropped to -60 in the state of Illinois. Finally, our final piece of work that's probably some of our most prominent work is the work that we did with the flood of 2019. I'm a member of the Illinois Incident Management Team, and I was deployed down to Winchester, where I spent 17 days working, building dashboards, building technologies that allowed the responders, the first responders that were on the scene, to understand the impact. And you can see the value of these technologies in the way that they visualize these different phenomenon. These experiences that I've mentioned have provided countless opportunities to our students. So we involve our students. We have student workers in the GIS Center. We involve our students on all different elements of this. We have them in search and rescue operations. Then during the flood, we had students working side by side with Corps of Engineers, Department of Natural Resources, Illinois Department of Transportation personnel. And in fact, one of our students, before he returned back to Macomb, he had a job offer from the Corps of Engineers and ended up taking a job somewhere else. But it just shows the impact and the importance of involving our students in these various efforts. They lead to internships, job opportunities, and the hands-on experience that has allowed our students to have 100% job placement in the job market. So we are here for the students, and we'd like to ask you to help us continue these missions of academic excellence, educational opportunity, social responsibility by giving today to the Student Emergency Fund. There's various ways that you can give to the Student Emergency Fund, and really encourage you to do that. Thank you very much. That's the end of our presentation. We'll be happy to field any questions that you have.
While we're waiting, if people are going to chime in, there's a Q&A element as part of Zoom that you can type questions to us. But just to reiterate Chad's point of student involvement in this, there's a synergy that exists between the academic department and the GIS Center, where the students start in classes like the ones I teach and then funnel into the GIS Center, come back out to take advanced cartography classes and so forth, and then prepare them for moving beyond Western and being impactful in the geospatial community. And of course, the nice thing about the GIS Center's role is that students get real world applications of geospatial situations, like Chad mentioned with the Taylorville tornado and the flooding last year, and beyond that. Students aren't just in a lab learning the conceptual and theoretical elements with GIS. They're actually working for actual consumers of the data, which are state and local governments, federal agencies, and so forth. I see Matthew Clark has a question about working with other institutions on the project. We are working with the University of Illinois and the Illinois Geospatial Data Clearinghouse pretty closely, as they've been doing a lot of work in converting the raw IDPH data into a geospatial form. But as of now, that's the only relationship that exists beyond WIU.
As far as universities go, there are relationships that we have with the Illinois Emergency Management Association, IEMA. They've been sharing this dashboard in the Emergency Operations Center in Springfield. We've also worked with the Illinois State Police and the Fusion Center. They have a firewall protected version of this that has more expansive information, live feeds to counts as they're coming in. Our data gets updated by the Illinois Department of Public Health on a daily basis around the time of the governor's press briefing. So we've worked with these partners. We're on the phone, it seems like, daily with them. There's always, with technology, there's always the occasional glitch that happens. Sometimes our data doesn't update, so we're on the phone, rebooting servers and working with them. It's been really good relationship, really good building of teams to keep these tools open and keep them going. Good question, Matthew. There is opportunity to work with other universities, definitely. Through Ilgisa, we've got an initiative where we're reaching out to universities throughout Illinois that have GIS programs. Sometimes the GIS programs are in the Department of Geography, Aegis, like here at WIU. Sometimes they're in an engineering field or computer science. It just kind of depends. It varies from university to university.
A couple of other questions that are really good. Pete Moggs, hey Pete, asks, how do you think the dashboard will change as we move from shelter in place to the initial resumption of limited activities in the state? One of the things that I envision is that when is mapping those sort of initial openings, if they're or at least in a list form. For example, the discussion of opening parks ahead of other kinds of things. And so those kinds of elements would be good information to have. And I think anything that we can do to facilitate with this one dashboard, the communication of relevant information is going to get integrated as it becomes available. And Sally Adams asked a fantastic question about if there's somewhere where we can see cases, deaths, and new cases for the state of Illinois as a list. Yes, there is, but we don't have that as something that's integrated yet. The Johns Hopkins actually puts out all of the county data. They do it for the entire country, but they integrate IDPH data for Illinois. And what they do is they have a location where they have all the tabular data available day to day since January. And as you might expect, it's a bit of a labor intensive process to pull some of this stuff out. But in terms of our dashboard right now, daily cases are available on those two graphs where you can, the numbers aren't there as a list, but you can actually probe them. The idea of a list is a good idea, and thanks for that, Sally. But there are all sorts of things that we've considered as we've been moving forward for this, but the really labor intensive ones have been sort of minimized because, as you might expect, just the dashboard in its current state is pretty labor intensive as it is.
We've got a question on how much time did this take? Well, it's been a process. So Chris and I started back in late March with putting the dashboard together. I haven't tracked my time in it, but I would guess that Chris has a couple hours each day updating the various data elements. I've got a couple hours each day working with the various agencies, making sure that they're sending us the right data whenever there's a problem. Sometimes it takes more time, and it spikes a little bit. Thank you. I agree that this should be used at the federal level. There are various states that do have their own dashboard, and Chris mentioned the Johns Hopkins dashboard, which it shows data nationwide. And if you go to the list of Illinois Geospatial Data Clearinghouse resources, it does have a link to the Johns Hopkins data set there that has more expansive data.
Yeah, and they have a couple of shortcomings, which I harp on. One is that it's the county level map for the whole U.S. that they do, where they put their data out there, is pretty ugly. A lot of these maps are about getting the data out, and they don't spend a lot of time about how effective the maps are at communicating the information. And of course, they don't use the Western colors, and that's important. So for us in this dashboard. By the way, to follow up on Chad's comment about how much time we spend on this, as he mentioned, this is a process, and what has happened as time has gone by, and he alluded to this, is that the roles that he and I both take have solidified, where I'm spending a lot of behind the scenes time on the dashboard itself, on the maps, making sure that the classification schemes are effective, that we're not losing data from somewhere. And Chad's role has really expanded in the connection between agencies and working with folks like at the Illinois Geospatial Data Clearinghouse, and making sure our communication with those folks is enhancing what we're doing on the dashboard side of things.
We have had a couple of technical issues where maybe data doesn't update in a timely fashion, and we're just passing through a lot of this stuff, and so we have to scramble to get figured out what's going on. And usually our outages have been in the order of minutes, maybe a minute here or there. Did share this with the team members of the incident management team, and it was very well received. Like I mentioned, this has kind of become the official version statewide, and it's shared out through various sources with our state agencies and our partners at IEMA, FEMA, ISP, and others. I think we might have time for one more question if there is one. We've got a hard stop time of 9:50, so we're running right up to that time. Chris, do you have any parting comments before we wrap this up?
Well, I think it's been certainly it's been a learning process for us as we've gone through. Our skills are in GIS and communication of data, and not in COVID-19. And a lot of times when we post things on Facebook and so forth, we get a lot of questions about when the peak is going to occur, and the sort of the mechanics of the virus itself. And so we have to be careful about not trying to pass ourselves off so much as experts on the disease, as opposed to experts on communicating the information about the disease. It's been, I just do some pushes on social media. Every day I do one on my own personal Facebook page, but we do the department Facebook page, the Illinois Geographical Society Facebook page, and then for those of you who are familiar with the Facebook group for the mega reunion for Western in 2020, I post in there, and the response has been overwhelmingly positive from folks, and it's been it's been rewarding not only to put something meaningful out that people can use and respond to. But a big part of what Chad and I discussed at the very beginning of when we this Western faculty and staff, and we are putting this out to show the state and the rest of the world what Western can offer during this crisis, and this is our contribution to that.
Yeah. So, like we said earlier, this is the Purple and Gold Day of Giving. So please give frequently, give often, give a lot. We know this is for the Student Emergency Fund, that all these students that have been affected by COVID and a lot of the uncertainty. It's a really scary time for college students with a lot of the uncertainty. So please consider giving to Western. We've got a couple other questions. Matthew, is there a way to continue to build on our success, to continue to be a leader nationally? So yeah, I think things like this, where we're getting the dashboard out there. Chris gave a Rotary presentation yesterday. We've got plans in the works to give presentations on the success of the technical details of how we've built these dashboards throughout the country. So yes, I think we are looking at a lot of ways like that, Matthew. Pete Moggs said thank you. We got a couple comments. Keep up the good work. Appreciate those. It is 9:50, so we are going to stop here and give some time for the next speaker to get set up. Please continue on listening to the various presentations throughout the day, and have a nice day. Thank you, everyone.
Thank you.